Okay, so this week's case study asks us to discuss strokes and, in particular, the use of TPA. So I just made a couple of slides talking about strokes. TPA is mainly used with ischemic type strokes, not with hemorrhagic, as they make up less than 15% of the strokes, and generally the survival rates are very low with a hemorrhagic slow stroke. Um, so the first thing that's necessary is to recognize the signs and symptoms of a stroke. So I just put a couple of those here to the right. You they're pretty typical. You've probably seen them on television, but you have trouble understanding words, trouble speaking, numbness in your face, arms, and legs. Some people have loss of balance or droopy eyelids, sudden severe headache, blurred vision, drooping, difficulty walking, like they can drift. And then I did just put a note at the bottom. There is the Glasgow Coma Score, which is a, a scale that EMTs and medical providers sometimes use to rate the severity of the stroke. So, an ischemic stroke, as mentioned in the prompt, you can quickly give an aspirin or an over the counter anti inflammatory. The EMTs keep aspirin. And you can hope that this mild blood thinner will kind of get things moving and stop any more clots from happening. And it really has mild side effects for most people. So the aspirin won't leave any significant damage. Um, for more severe cases, you're going to want to transport the patient to the hospital and look into TPA, which is tissue plasminogen activator. The trade name is Alteplase, one of them. There's some more. And what is it? It's a serine protease. So it's an enzyme that cleaves the peptide bonds in the protein, so in the proteins of your blood. Some conditions of note that might make you ineligible to receive TPA: if you're having a hemorrhagic stroke, if you're having a brain aneurysm, similar head injury, if you have a clotting disorder like hemophilia or other genetic bleeding disorders, if you're pregnant, if you've recently had surgery, or if you're on any blood thinners or with uncontrolled high blood pressure. Those are all contraindications. So how does the TPA work? Well, so you have maybe 3 hours is like ideal, less than 3 hours, 4.5 max. A lot of people will experience stroke and heart attack together, but the TPA, it catalyzes, as mentioned earlier, the conversion of the plasminogen to plasmin. And plasmin is that primary enzyme that dissolves your blood clots. So the TPA attaches to well, I'll go to the left side second. It cleaves the zymogen plasminogen and that's just the specific at arginine and valine, the specific spots, and the peptide bond to form this serine protease. And then it breaks the cross links between the fibrin molecules, and the plasmin only works in the area near the clot. So then, if you look at the left side of the slide, there's four kind of bullets. It attaches to the fibrin on the surface. The attachment activates the plasminogen. The plasmin's cleaved, and then the plasmin breaks up the molecules of fibrin, and the clot dissolves. Um, I don't. Yeah, there's no more slides. But hopefully that helps you figure out how TPA works this week.